Here's an episode on personality disorders, brought to you by Mentis Lab. So what is a personality disorder? A personality disorder is a mental health condition characterized by long-lasting rigid, unhealthy patterns of thinking, functioning, and behaving. According to the DSM-5-TR, a personality disorder is an enduring pattern of inner experience and behavior that 1. Deviates markedly from the norms and expectations of the individual's culture. These behaviors differ significantly from what is considered acceptable or typical within their socio-cultural environment. 2. Is pervasive and inflexible over time, which means the pattern is evident across a wide range of personal and social situations and does not easily adapt to changing circumstances or demands. 3. Has an onset in adolescence or early adulthood. 4. Is stable over time. Maladaptive pattern remains consistent throughout different stages of life and does not occur as perhaps a temporary reaction to stress or life events. 5. Leads to clinically significant distress or impairment. So in simple terms, people with a personality disorder are not able to function effectively in their daily lives, as their functioning is impaired. Let's discuss classifications of personality disorders based on DSM-5-TR. The personality disorders are grouped into 3 clusters based on descriptive similarities. Cluster A. Individuals with these disorders appear odd or eccentric. They are socially detached, suspicious or distrustful, unusual or eccentric in their thinking and behavior. Disorders included here are paranoid personality disorder, schizoid personality disorder, schizotypal personality disorder. Cluster B. Individuals with these disorders often appear dramatic, emotional, or erratic. They display emotional dysregulation, impulsivity, unpredictable or attention-seeking behavior, difficulties in interpersonal relationships. Disorders included here are antisocial personality disorder, borderline personality disorder, histrionic personality disorder, narcissistic personality disorder. Cluster C. Individuals with these disorders often appear anxious or fearful. Individuals experience excessive anxiety or fear, feelings of inadequacy, dependence on others, need for control and certainty. Disorders included here are avoidant personality disorder, dependent personality disorder, obsessive-compulsive personality disorder. Okay, now let's briefly examine each of the personality disorders included in the DSM-5-TR. So starting with cluster A, often referred to as the odd or eccentric cluster. According to the DSM-5-TR, paranoid personality disorder is a pattern of distrust and suspiciousness such that others' motives are interpreted as malevolent. In other words, individuals consistently suspect that others intend to harm, deceive, or exploit them, even when there is little objective evidence to support these beliefs. Schizoid personality disorder is a pattern of detachment from social relationships and a restricted range of emotional expression. Individuals typically prefer solitary activities, show limited interest in forming close relationships, and may appear emotionally distant or indifferent to others. Schizotypal personality disorder is a pattern of acute discomfort in close relationships, cognitive or perceptual distortions, and eccentricities of behavior. These individuals often experience difficulties in social relationships and may display unusual beliefs, perceptual experiences, or behaviors that others perceive as odd or eccentric. Moving on to cluster B, which includes disorders that are often described as dramatic, emotional, or erratic. According to the DSM-5-TR, antisocial personality disorder is a pattern of disregard for, and violation of, the rights of others, criminality, impulsivity, and a failure to learn from experience. Individuals frequently engage in irresponsible, deceitful, or unlawful behaviors and often demonstrate little remorse for the consequences of their actions. Borderline personality disorder is a pattern of instability in interpersonal relationships, self-image, and affects, and marked impulsivity. Individuals often experience intense emotional fluctuations, unstable relationships, fears of abandonment, and difficulties maintaining a consistent sense of self. Histrionic personality disorder is a pattern of excessive emotionality and attention-seeking. Individuals often feel uncomfortable when they are not the center of attention and may display dramatic, expressive, or attention-grabbing behaviors. Narcissistic personality disorder is a pattern of grandiosity, need for admiration, and lack of empathy. Individuals typically possess an exaggerated sense of self-importance, seek excessive recognition, and may struggle to recognize or appreciate the feelings and needs of others. Finally, we come to cluster C, which consists of anxious and fearful personality disorders. According to the DSM-5-TR, avoidant personality disorder is a pattern of social inhibition, feelings of inadequacy, and hypersensitivity to negative evaluation. Although these individuals often desire close relationships, their fear of criticism, rejection, or embarrassment leads them to avoid many social situations. Dependent personality disorder is a pattern of submissive and clinging behavior related to an excessive need to be taken care of. Individuals rely heavily on others for reassurance, support, and decision-making, often fearing separation or abandonment. Obsessive-compulsive personality disorder is a pattern of preoccupation with orderliness, perfectionism, and control. Unlike obsessive-compulsive disorder, which involves obsessions and compulsions, OCPD reflects a long-standing personality style characterized by rigidity, perfectionism, and an excessive need for control. In addition to these 10 personality disorders, DSM-5-TR also includes several other diagnostic categories. According to the DSM-5-TR, personality change due to another medical condition is a persistent personality disturbance that is judged to be the direct pathophysiological consequence of another medical condition. Examples may include personality changes resulting from neurological disorders, traumatic brain injuries, or frontal lobe lesions. Other specified personality disorder is used when the general criteria for a personality disorder are met, but either traits from multiple personality disorders are present without meeting full criteria for any one disorder, or the presentation reflects a personality disorder not included in the DSM-5-TR classification. Unspecified personality disorder is used when symptoms characteristic of a personality disorder are present, but there is insufficient information to make a more specific diagnosis. With that, we conclude this session. For more such videos related to psychology and neuroscience, don't forget to subscribe to Mentis Lab. Thank you.